From the hospital to homelessness, WRAL Investigates has heard from multiple families in recent weeks telling us the same story.
Their loved ones went to Holly Hill Hospital for mental health treatment in Raleigh, and they ended up on the street. That's a facility we've reported on extensively. WRAL's Sarah Kruger is asking which policies are in place so this doesn't keep happening.
Two families with one connection, Holly Hill Psychiatric Hospital in Raleigh.
And I was just livid.
She could be dead now.
Did it seem like they cared about your son?
Absolutely not.
Independently, each of these families reached out to the WRAL Investigates tip line. Their stories are very similar. They say their adult loved ones were involuntarily committed to Holly Hill. And then they say those loved ones were released to the streets and nobody notified them.
And she's been roaming the streets of Raleigh with the homeless people.
Robert Herring says his sister, who has a traumatic brain injury, was, unbeknownst to him, wandering downtown Raleigh for more than a month. Then in mid-February, he says an EMS worker found her and reconnected her with family who, all this time, thought she was still at Holly Hill.
And I asked her, what did you eat? She said, whatever I could. Where did you sleep? Wherever I could.
So is your understanding that Holly Hill just opened the doors and said,
"You're
okay,
out."
goodbye?
That's exactly the way I felt.
A similar situation for Betty Keith's son. Unlike the Herring, she says she did get a heads up from Holly Hill that he was going to be discharged on January 8th. Yet she claims they told her he would be brought home by a deputy, which both families say has been standard practice in their many dealings with involuntary commitments. But that did not happen.
Brian called me. He was just in tears. He couldn't hardly talk. He said, "Mama, I am freezing."
She says he ended up at a homeless shelter, thankfully able to remember his mother's number to call that same day.
That is inhuman to me, to send somebody off on the street.
WRAL Investigates sent a number of questions to Holly Hill's CEO, Lee Holston, including how they ensure patients are released in a safe manner and asking if there are policies for notifying family or the sheriff's office to get patients a ride home. Her initial response did not directly answer most of my questions, which I pointed out to her. And then I got a statement saying, in part, Holly Hill Hospital generally works with family members to arrange and ensure safe transport of patients back to their homes or community residence as appropriate.
It is such little help out there for mental illness. It is so sad.
WRAL Investigates has done more than a dozen stories about issues at Holly Hill's adult and children's facilities, including escapes, fights, and claims of staff over-medicating patients and falsifying documents. These two families now joining the call for change.
Why are they still up and operating if they can't run a facility?
Sarah Kruger, WRAL News, Raleigh.
This is a story that only came to light because someone reached out to us. If you have a story that needs investigating, email investigates@wral.com.